Hey everybody, welcome back to the show. So great to have you here today. Brand new Cabral Concept each and every day. As always, today I want to bring you a show that will affect 8.8 out of every 10 people. That's 88% of people living in the world today will be affected by this by the time they reach 65 or older. But even if you're not 65 years old, this is something to worry about today. And the reason is, like most dis-ease in the body, it grows over decades. It isn't just created by the time you hit 65 or 70. And what am I talking about here today? Something that we never talk about, right? That very few people even ever think about until it happens, and that is gum disease. Probably better known as receding gums and gum-based inflammation. And what that means is that most people start to feel it as a sensitivity at the top of their teeth, where the teeth meet the surface of the gum. It could be on the bottom or top teeth, a lot of times on the top teeth, back towards the molars. Now, again, it's often first felt as pain or tingling in the teeth as you're brushing. I'm going to go through here today how to prevent it to the best of your ability, what some of the potential issues are if you do start to get gum disease, and much more. So if you're unfamiliar with gum disease or gum recession, again, it can be called gum receding, gum recession, gum-based disease, but essentially the gum starts to pull away from your teeth. And as it pulls away from your teeth, the roots underneath are exposed. When that happens, there can be issues then with the bones, the strength of the teeth themselves, sensitivity because the nerves are now exposed. So that's going to create potential nerve-based pain. And usually it starts as mild and it can start to work then up to more moderate or severe-based pain and bone-based issues in the gums. So one of the first things to do is just be aware that when you are brushing or you're flossing, if there's any pain or sensitivity, maybe even increased bleeding or anything like that, which could show sensitivity or inflammation of the gums. If you're going for your tooth-based cleanings, hopefully you are going once or twice a year, that you're qualified dental hygienist is actually checking for this, and they're just making sure that it is not getting worse over time. Usually they just literally are measuring the recession of the gums themselves. Sometimes you'll notice it earlier than a dental-based appointment from hot or cold-based drinks. It could cause sensitivity up towards the gum line. So here's some reasons why people start to get receding gums in the first place, because after all, we don't want to just worry about it. We want to know how we might get it in the first place. And then I'll give you a few other things to watch for as well. So one of the biggest, especially when you're younger, because I was absolutely at fault with this, is brushing too hard or with a hard bristle toothbrush. I'm one of those individuals where, you know, at least back in the day, I certainly believe this, probably only the last few years I've started to do less of it, but if a little is good, a lot must be better, right? So I brushed my teeth for like 5+ minutes, and I would brush pretty aggressively as a child because I figured, hey, if it's worth doing, might as well go all the way. And the problem is I started to get receding gums even as a late teenager, probably early 20s, until a dentist said, you need to use a soft bristle toothbrush so it doesn't feel like when you use a hard bristle toothbrush, it feels like you're cleaning your teeth, right? But a softer one is going to be gentler on the gums. And you want to brush down gently from the gum down to the tooth, not just side to side, which is going to be abrasive on the gums themselves. Now, I know a lot of people use an electric toothbrush, and you're welcome to do that as well. It can be a little gentler. It can massage the gums, and that might be better for you as well. But that is something, and one of the big reasons. Do not allow tartar or plaque buildup on your teeth. Just having food caught between your teeth, letting plaque build up, all of these things create inflammation, poor blood flow, and that can cause gum recession as well. Any type of trauma to the mouth or gums can certainly cause gum recession. Misalignment of the jaw, I'll be talking about that a little bit in a moment, can certainly cause some gum recession. So not all of us were able to do this as a child, but being able to maybe get a palate expander or get proper alignment of the upper and lower teeth, so there's not an underbite, not a bite towards one side, but actually a proper bite of the jaw is extremely important. And then this is something I'm going to share just in a moment as well, when we're going to do like what can we do to prevent it. But believe it or not, smoking is a big thing for gum disease. And the reason is it's just the massive free radicals and antioxidants plus the dry mouth that it can cause as well. The last one is lip and tongue piercings. I didn't look into this too deeply, but I'm assuming if you have a lip or tongue piercing, it could press up against the gums itself. I don't know how a tongue piercing exactly is going to do that, but maybe the front teeth. I think really what you're looking for is any type of lip piercings or anything that might be pressing against the gum. Certainly not my expertise, but I wanted to add that one there because it is in the research. All right, so what can we do? You know, like here's the thing. You're 35 years old, 50 years old, 65 years old, 85. Like what do you do if you have receding gums or you don't and you want to prevent them? You don't want to be part of the 88% of people who ultimately will have some level of gum recession. All right, so one of the best things that you can do is to brush your teeth twice a day. Some people don't like to brush their teeth. Believe it or not, it really is a thing. My recommendation, now a lot of people argue and say, wait an hour or two until after you wake up to brush your teeth. From what I've seen in the research and the people that I've spoken to, when you wake up in the morning, you have more bacteria in your mouth. It's a little bit more of an anaerobic based environment. It is good to brush your teeth. You can do your oil pulling, but you can also use a tongue scraper, a copper tongue scraper, to scrape the tongue if you'd like as well. I have a very simple routine. I'll try to link this up as well at stephencabral.com/3268. That's today's show of different biological dentist-based techniques I've given in the past. I've even given some great books on biological dentistry that just a really simple morning routine. And there's just such great products, and it's only going to take you 5 to 10 minutes in the morning. And I'm someone just like anybody who doesn't want to spend a lot of time with their oral hygiene-based care, but these are the teeth that hopefully you keep for the rest of your life. All right, life. So brushing twice a day, flossing once daily. I can tell you for sure that I'm guilty of not flossing daily. I don't like to floss, to be honest with you, but I do it. And the reason is that it strengthens the gums. It helps to remove food between the teeth that you're not going to get while brushing. And that will allow then for less inflammation in the mouth and anaerobic bacteria that could ultimately cause gum recession or cavities as well. That's one thing is you start to recede those gums and it pulls away from the teeth. It can make cavities, unfortunately, a lot easier to come by. And that's certainly not something that we do want to do. I will tell you this. One of the recommendations by the Cleveland Clinic that I can't stand by is using an antimicrobial mouthwash twice daily. And that is because, and I don't know why they would recommend this, is that I've shared with you the research on this, and you can just look it up at stephencabral.com/podcast as well. But those people that use antimicrobial mouthwash like a Listerine and others, they actually have higher rates of potentially high blood pressure and type 2 diabetes. And that is because you get lower levels of nitric oxide production when using these antimicrobial, antibacterial mouthwashes. So if you want a more natural way to do this, something that I do, you will use a natural oil for oil-based pulling or an oil-based pull formula. There's a lot of great brands out there as well. And you can use one typically with a sesame oil base or a coconut oil base. Either one, whatever you prefer. In Ayurvedic times, it was typically always a sesame oil base, but coconut oil can be great as well. All right. The next one is using that soft bristled toothbrush. I did talk about that. I recommended that. There's so many toothbrushes now that are made with plastic siding and all sorts of things. I recommend staying away from those. There's no need to put the plastic in your mouth. Like the plastic, it looks like rubber, but it's essentially plastic coated. You want to keep all that out of your mouth whenever possible. Just try to use as natural a toothbrush as possible. All right, talked about no smoking. We certainly don't want that. Any type of smoke is not good for the gums and the teeth, and that includes chewing tobacco as well. All right. So those are traditional recommendations given by your typical dentist, and those were on the Cleveland Clinic site. What I wanted to do is share with you more naturopathic ones, more natural ones that you may not have heard about before. The first one is being careful to eliminate GERD or silent acid reflux. And the reason is when that acid starts to come back up, it affects the enamel on the teeth, as well as the gums themselves. So it also creates an anaerobic-based environment. I've mentioned that before, but anaerobic basically means without oxygen, and it's allowing certain bacteria that shouldn't be there in the mouth to begin to flourish. potentially lowering the pH in the mouth, wearing down the enamel, causing inflammation in the gums. So not great for your teeth, not great for your heart, believe it or not, as well. The next one is to stop dry mouth. A lot of people are dealing with dry mouth. I'll tell you, the number one reason isn't even really dehydration, although I think you should be cognizant of that. The number one reason is people are on medications. They're on all sorts of acid blockers, antacids, some antidepressants, etc., that can cause dry mouth. And so if you're on those, you really have to be aware that there are repercussions to these medications. And I'm not giving you medical advice or medical treatment plans, medical cures, medical diagnosis. I'm not telling you to come off these medications, but do look for the root cause. And at the same time, make sure these teeth stay hydrated. We do not want to dry out the mouth and the teeth. All right. The next one, eliminate sugary beverages in all ways, shapes, or form. Fruit is totally fine. It's not the same. We're talking about refined sugars. They are not great for the teeth, and they are certainly not great for the gums. Also, in that vein, talking about the same thing, this includes energy drinks and all acidic-based colas. Those types of things are not good for the mouth. Even if it's, let's say, a more natural version. If it has phosphoric acid and has any of these low pH based beverages, we want to be careful drinking those. All right, next one is stop teeth grinding. If your partner, or you just know, they're telling you, or you know that you're grinding your teeth, or your dentist saying, hey, it looks like you grind your teeth. Just be careful of that. That will wear down the enamel and affect potentially the gums as well. Spoke about it earlier, but it's really never too late to begin to work on aligning your bite. So one of the best things that you can do is start to breathe through your nose, keep the tongue resting on the roof of the mouth to keep it in place. Now, again, we do this better as a child, but if you go see, again, a good biological dentist, they can recommend someone to you to work on that bite as needed. It might take braces, it might take other things, but if it can help with your airway and it can help with your bite, help with your teeth for life, maybe that's a good thing. All right, the last one is improving your overall nutrition. This means getting the nutrients your body needs in order for it to be healthy and strong. And that includes these bones or your teeth. So part of it is the actual act of chewing. You should be getting in at least one good meal per day where you are really chewing for 15 to 20 minutes. And that's helping to strengthen the jaw, the teeth, all the bones in the mouth, everything that works. The musculature in the mouth, of course, as well. That's important. But getting all of your B vitamins, getting vitamin C, getting zinc, getting vitamin D3, all these things are critical for your body's overall health. So 7 to 9 servings of fruit and veggies every single day, getting in the carbohydrates that you need for your body, getting enough protein with the right amino acids to help rebuild the body, repair, and of course, good nutritional supplements. Find a good functional medicine brand that you like. Get something like the Daily Nutritional Support or Daily Activated Multi. Use your daily omega-3s, your vitamin D3, and maybe even a good daily probiotic support in order to help promote good, healthy gut flora, which at the same time allows for then proper digestion, nutrition of the nutrients you're taking in. Hopefully this was helpful, everybody. I'll link up a couple deeper shows at stephencabral.com/3268. Have an amazing day. I'll be back tomorrow with a brand new Cabral Concept. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything. Functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.